This is Dr. Schmo from the Functional Neurology Center and the Brain Health Online Summit. As a part of our Technologies in TBI mini-series, I'm going to be talking about just some simple tools that you can use at home to start assessing yourself to get a better idea of what areas of your brain could be malfunctioning or not doing what they need to do. So here we go. So this is just an at-home to-do list, some simple things that you can do, and there's some apps that you'll need. So one of them is called the heart rate app. It's free. We like to have patients look at their heart rate lying down, seated, standing, and look at the change from going from that lying to seated to standing position and see if there's an increase in your heart rate over 30 beats. We know with traumatic brain injury, vestibular disorders, people can have underlying dysautonomia, which comes from changes essentially in the brainstem, as well as multiple different areas up higher in the cortex, in the amygdala, in the cingulate, in the hippocampus, in the basal ganglia. There's multiple different networks and circuits in the brain that are involved with autonomics, allowing you to get blood flow to areas that need it. So you obviously want to get blood flow back up to your head. And if you're not doing that because your brain circuitry is not functioning appropriately, we need to figure that out. The next app is called Smart Optometry. And with this app, we're going to look at changes in your eye position. We're also going to look at, are there changes in your brain's perception of red color between left eye and right eye, which helps us just kind of get a better idea of central autonomic regulation. And if there's anything that's going on with the retina and the optic nerve going back, people can develop optic neuritis, people can have changes after TBI, people can have changes in the red saturation from migraine and dysautonomia. Another app, it's called EQ Brain Performance, and I'll go into that a little bit more in depth. They do have a free trial, and you can download this. You can use it at home. You can use it with your family. We like to use it here in the office just to get a better idea of how patients are progressing through care. So we have them do this at home and assess themselves and get a better idea of their symptom score, how their symptoms are progressing, and are they making improvements with their balance, with their reaction times. It's in my opinion, it's one of the best at-home apps out there right now. So the first thing that we're going to do is check blood pressure, and we're going to do it with both arms. We're going to do it lying, seated, and standing, and we're going to do it on both sides. We're going to do it bilateral. And we're going to see if there's any symptoms of dizziness, lightheaded sensations, moving from the seated to standing position. If you don't have a blood pressure cuff, then you're just going to skip this and you're going to move on to heart rate at 2. So one of the things that you can see with autonomic dysfunction is as you go from seated up to standing, you can see the blood pressure drop. Right? If your blood pressure is dropping, you might have symptoms of lightheadedness, dizziness, anxiety. You might feel like you're going to black out. People can develop POTS, post-concussion, or positional orthostatic tachycardia syndromes. Another thing that can happen is you can also stand up, and then you can actually see your blood pressure increase. All right? If you stood up and your blood pressure decreased, most likely there's a change in how your sympathetics are integrating and driving blood to your head. If you stand up and then your parasympathetic system fails and you see your heart rate and your blood pressure increase, then you'll see more of a sympathetic drive as you're going from seated to standing. Another thing that can happen is you can stand up, you see the heart rate go up over 30 beats, and then you have the blood pressure drop. So based off of what we see here with your blood pressure and your heart rate, there are different types of therapies that can be performed and different things that you can do at home to hopefully make some improvements in your symptoms. So here is the heart rate app that we recommend. And then we move on to the red desaturation. And that's the test that you're going to perform. And we're going to have you look at covering the left eye and then switching, looking at the right eye and comparing the color red between each eye. If you want to learn more about this test, you can just go on to Smart Optometry, red desaturation, and read more about it. There is central autonomic regulation to the retina that can be affected from changes in how your brainstem modulates your sympathetic system, and it can lead to vasoconstriction, which can lead to changes in retinal blood flow that we've seen clinically with people, and they can actually do therapies that will modulate your autonomics, and you can see improvements in the red testing pre and post therapy, which lets us know that most likely it isn't from your like changes in the optic nerve or optic neuritis. The next test, it's a corneal reflection test. You're going to shine light. You're going to use the smart optometry app. You're going to shine light, and you're actually going to look at the position of how light is hitting on your pupils. And depending on how the light is hitting on your pupils, it can tell us if your eyes are esodiviated, exodiviated. There's a hyperdeviation. When patients have vertical heterophoria or a vertical deviation, a lot of times people will experience visual induced vertigo. They might feel out of body, have a really hard time driving. When people are moving and translating forward, they could feel like maybe they're rolling. I have a vertical deviation. I actually have a prism in my right eye to bring it down after some whiplash skiing concussions. And the glasses that I have are very helpful. I'm obviously doing rehabilitation to try and make improvements so I don't have to wear the glasses. But wearing the glasses definitely helps with symptoms in terms of reading and driving and just functioning in everyday life. So based off of the deviation of how your eyes are, there are different therapies that we can recommend and that you can do, and exercises that you can do to help make changes to this central integration. There's a lot of feedback that comes from your cervical spine that can fire into the brain, into different nuclei in the brainstem that fire out to eye muscles to control their position. There can also be issues that are going on with your vestibular system and how your vestibular system processes information and how that feeds into the brainstem and links in with eye position. So there's a lot of sensory integration that occurs in the brainstem and the vestibular nuclei. And those vestibular nuclei are actually located right next to some of the autonomic nuclei that help you get perfusion and autonomic and blood flow to your brain. So when patients have these visual vestibular mismatches, a lot of times people will just feel really foggy, dizzy, lightheaded, have autonomic symptoms, have gut symptoms, they have anxiety, depression. So having these issues with your eye tracking and your eye position can have a whole body effect, and it can even go in and affect the gut and can affect you metabolically. And if it's been going on over time, there can be a lot of just kind of your system's not calibrated and you start to develop more fatigue. And we need to figure this out, figure out the position of your eyes, figure out, is there any changes in your autonomic function? Are there any changes in your heart rate and blood pressure? And make sure we document that, because it could be the thing that needs to be worked with to make improvements. Here you can go and look up EQ Brain Performance. You can download the app online. You can purchase that. I do believe that they do have a free check-in that should be going on right now. So far, we've assessed autonomic function, balance, eye tracking, vestibular cognitive function, and now we're going to move on to more ocular motor and vestibular. So based off of everything that we just went through, we just actually hit autonomics, vestibular cognitive, and that's amazing for, basically spending about 15 minutes at home and assessing this. Number 6, what we like to do is close eyes while seated. I want you just to close your eyes, and you're going to stay in that position for 1 minute. And we want you to know, do you feel unsteady? So if you close your eyes, do you actually feel like maybe you're spinning? Are you rocking and rolling? Do you feel like you're floating? Do you feel dizzy? Do you feel like your eyes are actually drifting or moving underneath your eyelids? When you just sit here and close your eyes, there are a lot of systems that are integrating. Your brain wants to know where you are in space, so gravitationally, you're detecting information from your inner ear and your otolithic system, combining that information with proprioceptive feedback from your cervical spine that integrates into the cerebellum, that goes into the brainstem, that goes up higher into the brainstem and up into the cortex, into your parietal insular vestibular region. And then that gives you an idea of where your body is in space. And then that information gets fed forward into different motor programs to allow you to move effectively and move throughout space, absorb force, and not have your muscles start to break down and have that force go into areas where it's not supposed to go and lead to tissue trauma and lead to pain and dysfunction. So eyes closed, well seated, and we're looking to see if maybe you have nystagmus, maybe your eyes are actually doing some sort of drift, maybe there's a slow phase and a fast phase. If you're feeling floaty, it could be from multiple reasons. Usually it's a central otolithic disorder. If you feel dizzy with your eyes closed, well, there's something that's probably going on with the feedback from your neck or your central vestibular. And if you feel unsteady, again, it's probably either coming from the neck or central vestibular. And then what we like to do is just start checking different head tilt positions. So we want you to tilt your head to the right, tilt your head to the left, and with those positions, with the eyes closed, does it increase any symptoms, or do you have an improvement in symptoms? So maybe you feel dizzy here, but you tilt your head to the right, and then all of your symptoms go away, which would be really cool. If you go here and you tilt your head left, maybe you have an increase in symptoms. So as you're in this position and you start tilting the neck, the issue could be your neck. It could be coming from your cervical spine and that feedback into the brain, but it could also be from gravitational position sensors in the otolithic system in your inner ear and how that information is going into the brainstem, or it could be both. It could be a neck issue, it could be a central vestibular issue. So we want you to make a note of that, take that information and write down, do you have symptoms either left or right? And then we want you to lie down on your back, and then we look at, well, lying on your back, we decrease the gravitational load. Do your symptoms actually get better, or do they get worse? So say if you're up in gravity and you have increased symptoms and you go down and all of your symptoms go away, most likely there's something autonomic occurring, or there could be something going on with your cerebellum where as you're up, it's just not integrating the information correctly. So when you lie down and have potentially less gravitational load on some of those spinal intrinsic muscles and changes in feedback to your central vestibular system, maybe your symptoms get better. In some patients, you'll lie down on your back and you might feel dizzy or spinny or feel like you're rotating. And then we're going to have to question, maybe there's something going on with positional vertigo or BPPV. And then that would be needed to be addressed, most likely by a provider that knows how to reposition you to make improvements. If you have any of the above symptoms, there's most likely a change occurring with your central vestibular integration as it relates to your neck and eyes. Number 9, we want you to basically, you're going to bring up your thumb and you're going to keep your eyes on your thumb for 10 seconds and you're going to note your eyes feel steady. Do you experience any difficulty holding your eyes steady? Do you feel dizzy? Do you feel like your eyes might be drifting? Do you feel like there's eye strain, or do you feel like there's headache? And that tells us that maybe there's some sort of abnormal oscillation or movement that's not supposed to be there when you're trying to keep your eyes steady, locked in on a target. All right. There's different integrators in the brainstem, and these integrators fire out to your eye muscles and position sensors in the eyes to keep your eyes steady. And there's feedback that comes from the cerebellum firing in to keep your eyes steady, and the frontal lobe firing down to keep your eyes steady. In the frontal lobe, it loops down through pathways in the basal ganglia into the upper brainstem, and those fire out to different nuclei, and those fire out to eye muscles to keep your eyes steady. So because you can't keep your eyes steady, there might be different central circuits that are malfunctioning that are allowing your eyes to drift. And then we just want to do the same thing, left, right, up, down, depending on the position. It can give us an idea of, well, is there an issue more with this eye muscle or that eye muscle, or a gaze preference or something like that. And then what we want to do is just put a target on the wall. And what you're going to do is keep your eyes focused on that target. Remember where it is. Close your eyes, turn your head, bring your head back to center, and try and open up and keep your eyes right on that target. Another thing that you could do is actually purchase a laser that goes on the head, and that can go out. And then as you move your head and bring your head back to neutral, say if you're missing the target by 2 feet, most likely there is an issue with your brain's perception of your cervical proprioception and your feedback coming from your neck and your ability to know where neutral is with your cervical spine. And that gives us input that most likely there's a cervical spinal component to your symptoms. Right. So these are all the things that we have, patients do. Say, for example, if you came and worked with us and then you went home and we needed to reevaluate you, we would have you do some of this virtual stuff online and basically send the information back so we could get a better idea of what's going on. With things going on right now, we'll have patients do virtual examinations so we can assess them and then get a better idea of what's going on, and then just give some at-home simple things that you can start doing to hopefully make some improvements. And, in addition, we highly recommend working with, trained providers that are local with you as well to help with getting your symptoms better. So this was just basically just some simple things that you can start to do at home to try and get a better idea of, do you actually have something going on that can be helped with, integrating neurology and chiropractic and orthopedics together with different types of functional training. All right, so if you would like, you can just email us info@thefnc.com. We can send this to you and you can get to work and do this at home or share with any of your friends. Thank you, guys.